Welcome to the Softwave TRT Workshop. I'm your host, Dr. Jake Shupe, and I am very excited about what you guys are going to discover about Softwave therapy this evening. Um, this therapy has changed my life. When I was about 34 years old, 35 years old, um, my body started feeling differently. Accumulation of years of injuries and things have just accumulated where my pain levels were increasing, even with adjustments, even with taking supplements, even with um, all the things that I do for my health. Things were just not feeling good. And I told Christy, Dr. Christy, my wife, that I needed to do something extra. I needed to figure something else out. Otherwise, I wasn't going to be able to keep doing all the adjustments that I need to do. I wasn't going to be able to keep doing all the workouts and the exercise things that I needed to do. So I found Softwave therapy. My friend, who's also a chiropractor, he had just gotten one of these machines in his clinic, and I tried it out on my foot and my ankle, and immediately that day, like just an hour after I left there, it had made such a difference in the foot pain that I had. And I hadn't run for over a week because I was in so much pain. That day, I went out and I ran 10 miles, which I shouldn't have done, but I'm just telling you, that's how much better that I felt. After one session, I was pretty much sold. I'm like, yes, I have to have this. Our patients have to have this. Um, I'll share some other testimonials tonight, but um, just one other quick one. My bicep tendon, I had bicipital tendonitis for like a decade. I couldn't work out very often as far as like doing bicep curls. Every time I would do more than 15 pounds, like my bicep would flare up. I even had a hard time carrying groceries with my right arm. And since 2023 now, a little over a year, this is the first year that I'm bicep curling again, 25, 30. I'm even up to 35 pounds with the bicep curls for the first time in over a decade. So those are just two of many body parts that I've had to use this on, and many, many different testimonials that we've already seen in our office that I could even just have a whole workshop for a whole hour just sharing the stories of people that are feeling better and getting out of pain and seeing amazing progress because of what we're going to talk about tonight. So I'm excited for you to hear about it as well. Okay, just some housekeeping things here. We're going to go through just there's my overview of what we're going to talk about, and then at the end, you're going to have an opportunity to schedule your first discovery session, which is your first Softwave appointment in the office. If you want to do that, you'll have an opportunity to do that at the end. Also, I'm going to be raffling off for those of you who are on here live tonight. I'm going to raffle off a free discovery session, and we'll get right into it. So if you guys are note takers, I'd take some good notes down. So here's what we're going to be talking about this evening. What is a shockwave? Like, go a little bit into the science about what it is, how it works. We're going to compare Softwave to other types of shockwave therapy, knowing the difference there. We're going to compare it to other types of treatment approaches, safety and effectiveness. I've share a couple testimonials. I've already shared two personally. And then kind of what does the process look like? Like, how do you schedule your first appointment? How does that work in the office? Okay. So what is a shockwave? I'm going to read the definition, and then I'm going to explain it a little bit. So a shockwave is a type of propagating disturbance that moves faster than the speed of sound. Okay. So here's an example. A jet that's traveling at the speed of sound or faster, it creates a sonic boom. You may have heard this before at a distance. You may have seen one on a video before or heard about it, but that sonic boom from that speed of that jet, that boom is a shock wave. Okay. And that's over 767 miles per hour. And what I want to show you next is several graphs of what that looks like. So on the far left, you're going to see a shock wave, graph of a shock wave similar to what is in the Softwave machine. And then in the middle, you've got a pressure wave. And then on the far right, you've got ultrasound waves. Okay. And this is going to help kind of delineate and see how Softwave is different than other shock waves and different than ultrasound. Very, very different biological responses. So let's take a look here. So on this graph on the far left, you're going to see on the horizontal axis time, and then on the vertical axis pressure. So you've got that shock wave that's created from the speed of over 767 miles per hour. And then what you're going to see here is a very high, quick amount of pressure. This green line goes all the way up really, really quick and comes down really, really quick. Okay. So that's done in about 0.2 microseconds. And that reaches a pressure, an MPa of somewhere between 10 and 100. Okay. So it's a high pressure, short amount of time. And then at the very bottom, you're going to see a relatively low amount of negative pressure proportionally to the wave. That creates a very powerful yet safe biological response in the tissue area. That's what the Softwave machine does, is that type of shock wave on the far left. In the middle, you're going to see a radial pressure wave, a graph of what that looks like. You can see this is a lot different. That blue line, it doesn't go up quite as high, and it does it over a longer period of time. It's still pretty short, but it's much longer than the shock wave on the left. So there's a bunch of machines on the market that use these radial pressure waves. And technically, even though it is a type of a shock wave, you can see it's very, very different in the amount of pressure that it uses. And then on the far right, this is an ultrasound wave. Okay. Ultrasound machines are not a shock wave. They're not even a type of shock wave. They have much, much different benefits and effectiveness. And you're going to see a lower amount of pressure, and it's just this very equal up and down oscillation. Okay. So the one on the left, that is the type of shock wave that we're talking about tonight. So what are some of the amazing benefits of it? Well, one of the first benefits of Softwave is that it increases blood supply. In fact, it's been shown to increase nutrient-rich blood supply by up to 300%. And why is that important? Well, blood brings nutrients to an area. So when you start to increase blood supply, you can bring nutrients to it to help with the healing process. It also helps decrease inflammation. That's really important in the healing process as well. One that's not on here that I mention a lot that I think is a very huge one is that it helps break up scar tissue. Okay. So especially with chronic problems or longer term problems, breaking up scar tissue helps tremendously with range of motion, flexibility, pain, etc. And then the third bullet point on this list right here is one of the biggest, most important benefits, and one of the most important long-term benefits is that it stimulates and activates your body's own repair cells. And those repair cells are called stem cells. And what's cool about this is that stem cells can turn into any type of cell in the body. So let's say we did the treatment on a ligament in your elbow. When you activate stem cells, they can turn into and remodel and repair that ligament. But let's say that we did it on a muscle, a damaged muscle. That stem cell can repair that muscle. Let's say we did it on a tendon. Those stem cells can turn in and repair that tendon. If you did it on a bone, the stem cell can turn into and remodel and heal that bone. So, wherever you're using that to activate stem cells, it can help repair, remodel, and regenerate that type of tissue, which is very exciting and one of the big reasons why this form of regenerative medicine is so powerful. It also, other benefits, accelerates wound healing, has an antibacterial effect, fantastic at reducing pain, not just acute pain like a new you strained a muscle or you sprained your ankle recently, but even chronic pain. Like the amount of people that have had chronic like knee pain for years and years and years and decades. It can help a lot with even chronic pain. So another benefit, it's non-invasive. There's no needles that you're dealing with. I mean, you don't even have to be licensed. It's so safe that you don't even have to be licensed to be a Softwave technician. Like anybody could be hired to use the Softwave machine on somebody. As long as they know how to turn the machine on and off and put it on the right area, like that just goes to show. Like compare that to well, even a chiropractor for that matter, or a surgeon or a dentist or any other health professional. The have to be licensed and trained because there's safety measures. This thing is so safe, like you don't even have to be licensed to be performing the treatments. It's not invasive, hardly any downtime, no anesthesia is needed. That's pretty cool, especially for the huge upside. There's such a small downside. Now, is there any side effects? Let's look at that part of it. Okay. Is it safe? Are there side effects? I'll just tell you right off the bat, it's very safe. But there's some things that I do need to tell you. Softwave therapy is non-invasive treatment, and it typically has mild to short-lived side effects. Let's talk about what those are. So first one on the list here, pain. There can be some discomfort during the treatment, usually ends right after the session. That's a very common one. In fact, that's one that we're looking for. I'm during the session, I'm looking to work on some of the tender spots. Okay. But don't worry. Like I've never had a single person in hundreds and hundreds of people. I've never had a single person that's not been able to tolerate a session. There's different power levels that you can do, but the discomfort during those treatments, it's kind of, I like to think of it as like somebody who's getting a massage or like a deep tissue massage. I call it the good hurt, right? It might hurt a little bit, but it also feels good at the same time. And I try to keep the discomfort like no higher than like between like a 5 out of 10 and an 8 out of 10. And I can always keep it into a good range that's getting a lot done, but it's still very tolerable for the patient. So yes, there's going to be a little bit of discomfort. I usually spend about 60% of the time on the most tender spots. That's a given. Redness, swelling, and bruising. Redness, yeah, there can be some redness. Sometimes if you're going to increase blood flow to the area, blood is red and it's going to increase some redness. Swelling, I've only heard reported like 1 or 2 people that have told me that they've gotten any swelling from it, and I've never seen bruising. I've never seen it. Skin sensitivity, I've had 1 or 2 people maybe say that. It's not very often. Burns and blisters, I've never seen it. So says there's a risk of burns and blisters. So apart from the discomfort during the treatment that ends right after the session, um, I don't even hardly see any of these other things. I will say something that's not on the list that does need to be accounted for, that I unfortunately learned the hard way, is if you're going to be doing a treatment above the neck, you need to use ear protection. I actually got some ringing in the ears when I was working on my neck. So again, I read some case histories and things. And yes, this is one thing that you do need to be aware of. If you're working on the neck or base of the skull, ear protection is must, which we have 2 forms of that in the office for you to make sure we're protecting your ears. But other than that, and a little bit of discomfort during the treatment, it's almost crazy how safe this is and how little side effects. The upside is tremendous. The downside is very, very low. I mean, if there was a drug on the market that could help with pain and tissue regeneration as much as Softwave that had this little side effects, it would be it would be a $1 trillion drug. I mean, it would be unreal if there was something like that. So I'm just very impressed by it. All right, Softwave. Okay, this is the gold standard machine of shockwave therapy, and that's for a number of different reasons. This machine was created in 2004, so about 20 years now. It was created by Mark Gronowski and John Warlick. And just to give you a little bit of insight, this, even though you may have just heard recently about shockwave therapy, this has been around for a bit. Okay. And this machine, a lot of the research, a lot of the studies on shockwave therapy have been done with this machine. And there's been a lot of upgrades, a lot of tweaks, a lot of insight learned. This is the gold standard machine, and I'll show you a little bit as to why in a second. All right. So you might see an ad online, shockwave therapy, or you might read something. Somebody brought in something the other day from the newspaper. I didn't even know people advertise in the newspaper anymore these days, but they brought in something that had shockwave from the newspaper. Don't be fooled. You got to know what you're looking for. So not all shockwave therapies are created equally. Different marketing and things like that could lead you down a road where you could be severely disappointed with your results. Let me share a few things about how to look out for that. So here is about 5 or 6 pictures of current shockwave machines. On the bottom right here, there's one called Dual Wave. You know, these taller ones, they kind of look impressive. They can roll around, whatever. So we're going to look at price and then just tell us, we're going to look at how price tells a story as far as what these things can do. So this one on the bottom right is called Dual Wave. This is about $3,950. So let's just go ahead and say $4,000. Okay. This one on the top right, Impulse Wave, that's a $1,200 machine. This one right here on the bottom right middle, it's called Oceanus. This is almost 10 grand. Okay, so we've got a $1,200 machine on the top right, about a $4,000 machine on the bottom right, and then a 10 grand machine right next to that. And then on the far left, you can see this one that says Chattanooga. Again, another taller standing model. Looks pretty cool, if you ask me. That's a $17,000 machine. Okay, well, that's quite a bit more than the other ones. Just looking at these ones, and let's say you didn't know anything about the science, you didn't really know anything about the companies, and you just were hearing the price of these machines. Would you expect this Impulse Wave at $1,200 to have the same effects on your body and the same benefits as this $17,000 machine? No, you wouldn't. There has, with that much of a price difference, there has to be some sort of difference in the technology, how long the machine, how well it works, how long it lasts, the quality of it, and the effectiveness of it, right? Yeah, that's what most people would agree with. Well, that same concept applies when comparing all of these on this screen, including the Chattanooga, to the Softwave machine. Okay. This, when I bought this machine, I made a large investment. Okay. This is an $85,000 machine. And I will tell you that that is because the healing miracles that we see, all the research, all the studies, all the amazing benefits are because of the quality of and effectiveness of this machine over every other machine that I've seen on the market right now. So you got to know what to look for. And some of it goes back to the graph that I showed you on the type of shock wave that is the most effective. So don't be fooled by competitors. Softwave is the gold standard. There's only so I wasn't planning on talking about this, but I'll just say it. There's only, is there any other machine that you would even recommend? Honestly, not really. There's only one other one that's even closely comparable, and it's called stem wave, but there's still, in my opinion, quite a big difference between the two of it, called the stem wave machine. Still a large price difference. And so I would say really there's only one. If I was going to get shockwave therapy, there's really only one, and that would be Softwave. But just wanted to lay that out so you guys know that there is a lot of other companies that are trying to replicate this right now, and to look out for that. Softwave, trusted, proven results. I mean, this is the machine that pretty much all your major sports teams are using: the MLB, the NBA, the NFL, PGA, NHL. A lot of different of the individual teams have their own machine. It's been at Stanford Medicine, University of Pittsburgh, Walter Reed National Military Medical Center, the Mayo Clinic. I mean, everybody knows Mayo Clinic. So it's been in all the most prestigious places, still is. And is it backed? Is the technology backed by research? Well, let's look at that. 240 different scientific publications on Softwave from 98 different research institutions in 20 different countries. So again, I bring this up because sometimes people ask, like, how credible is this? Like, is there even any science behind this? Like, this is not just a machine that came out last week or last year even. Again, it was made in 2004. We've got almost 20 years of data behind it. And it's the machine that has the most amount of research. And that's why it's trusted. So that's some important stuff that I wanted to share about it. Then, some of the stuff that people care about is comparing it to, well, one of the big things that people really care about is like, what does it help with? How can it help me? I'm going to get to that in just a second, okay? Because we're going to look at all the different pain conditions and what those are, because those are what probably relate to what people want help with the most. Before we get into that, I want to compare Softwave to some other treatment options, because we just got done comparing Softwave to other shockwave machines. Now we're going to compare Softwave to other medical treatment options. All right, so let's take an example like chronic knee pain. Okay, some of you've had knee pain for 10 years. You don't know what to do, so you go to the doctor. Well, there's a few different common options for this. Okay, One, you could take pain meds. And whether these are over the counter or prescription pain medications, but problem with pain medications, they never get to the root cause of the problem. They are never going to fix your knee. They're only going to make you feel a little bit better. And of course, the long-term side effects, they might be the most cost-effective option on the front end, but they're never going to fix it. And you know that they're going to cause side effects down the road. So not a great option, in my opinion. Most people that I ask do not want to be on them. Another option is doing a cortisone shot. Okay. These are very common. Also, not that expensive. And if you're lucky, you're going to get 3 to 6 months of pain relief from a cortisone shot. Again, it's never going to fix the problem. In fact, it's only going to make it worse. And here's why. Most people, they don't always tell you this. In fact, most of the time, they're not going to tell you this. But cortisone shots, they destroy cartilage faster. Okay. They actually accelerate tissue destruction and cartilage. So that is going to, even if it works for 3 to 6 months, you're going to probably feel a bit better. And then just use and work out that damaged knee more often, making that break down faster. And the cortisone shot itself will destroy cartilage quicker. Not a great option. Plus, these weaken your immune system, so you become more susceptible to other illness and other infections easier. Again, I don't think there is any scenario where I'd ever recommend somebody getting a cortisone shot. What's another option for that chronic knee pain? Again, we're just taking the knee pain as an example. One other option would be stem cell injections. Okay, this is more natural, but you're still dealing with needles, but this is more natural. This is something that actually can help fix the knee. Okay, getting these stem cells, they can repair these different tissue types. But they do take a little while for them to fully adapt. A lot of times you're looking, 10 to 12 months for full effect of this. And they range between $6,000 and $11,000 for stem cell injections on a single area. Okay. So they do help. I do believe that they work and have a high level of effectiveness. Usually cost is an issue for some people. Again, 6 to 11 grand. Surgery. This is going to be your most invasive option. Success rates for like a knee replacement are, in my opinion, not great. Some people swear by them. A lot of people that I talk to that come into the clinic really wish they hadn't had them done. And a lot of times after a decade or so, you're going to need another surgery again. But anyways, I mean, it's the most invasive option. Something like a knee surgery, they're, for a lack of a better word, they're sawing your leg off, putting in a metal knee, and there's a long recovery time. And anytime you go under the knife, it's going to be a risk. And also, even with insurance, oftentimes people are paying thousands and thousands, tens of thousands of dollars out of pocket, even with insurance sometimes. So with Softwave being another option, it's kind of like, in my opinion, the best of all the worlds. It actually does help fix and repair the knee by increasing stem cells, repairing and remodeling damaged tissue. It's non-invasive. You don't have to deal with any needles at all. It has a faster recovery time and adaptation time than even the stem cell injections do. And it's 80% less cost than stem cell injections. And you don't have to go on the knife, and you can avoid the dangerous side effects of medications. So Softwave can help with tons and tons, not just chronic knee pain, like the example that I gave, but a lot of different health pain problems. So let's look at those. What are some different things that it's been proven to help with? All right. So we've got a few different things on the screen here. What can it help with? Shoulder pain. So this can range from, you know, uh, arthritic shoulder. It could be frozen shoulder where you have like no range of motion, can hardly lift your arm up. I'm working on a handful of those cases right now. Oh, let me share this with you. So a young man named Lloyd came into the office. He just wrote a really nice review for us on Google, and he came in and he likes to work out, and he was having pain. It was even hard for him to like push off, like even doing a push up hurt. He was having pain, and when I checked his range of motion in his arm on his very first visit, he couldn't raise his arm up all the way. And then we did his exam, his first Softwave treatment. We retook a picture. I've got a picture of him. He got his full range of motion back. That was like an extra 10 to 15 degrees of motion in his shoulder. The first treatment. I have a picture of him, this big grin, big smile on his face. And he's super duper happy. I think he went through about 8 sessions to get his shoulder to back to full functionality, and he's done for now, and he's super happy about that. But that was just one example. But it could be rotator cuff issues, it could be frozen shoulder, it could be arthritic shoulder, it could be AC joint problems. I mean, you name it, I've probably worked on it if it's a shoulder issue. Knee issues, oh, huge success rates with knee issues in our office as well. It could be something from a sprained ligament in a knee, um, to even really, really far along chronic long-term degeneration, arthritis. I mean, I've even worked on bone knees. Now, am I sitting here promising you that magically, after, 6, 8 weeks that you're going to have a, brand new non-arthritic knee anymore? No. But what I have seen is even in the most severe cases, I've seen people that are able to walk up and down the stairs without pain. They're able to get some flexibility and some range of motion back in their knee, start to, be able to walk up and down the street again, and really start to get their life back, even with some really severe cases. So again, sprains, ligament issues, meniscus problems, and even chronic arthritic issues with knees. We can use it on the spine as well, back pain, sciatica. In fact, I'm working with a lady right now, and she's had incredible improvements with her sciatica. She came in, she was could hardly walk. She was bent over, and like 2 sessions, she was walking straight again, much happier, moving quicker, and she's doing a lot better. Neuropathy. So lot of case studies to see how it can help with neuropathy. Neck and upper back pain, we can use that on the spine. Again, once we get to the neck and above, we need to be making sure we use ear protection. Elbow issues, that could be golfer's elbow, that could be tennis elbow, tendonitis. Hand and wrist issues, we help a lot of carpal tunnel type problems, multiple different plantar fasciitis cases. In fact, I had a lady who came in with not only plantar fasciitis, but she had this cyst that was like the size of a marble on her foot. And in about a month and a half, that cyst reduced by about 70%. I mean, it now is just like teeny tiny little bump in there, which was awesome. Hip pain, that could be arthritic hip or just a strain in the hip, either one. Some other things that it can help with. Some of these I already kind of went over, but some of them that I didn't. Foot pain, ankle issues like I had problems with, tendonitis. like overuse injuries. A big one that I want to point out in the middle of the screen, post-surgical recovery. Let's say you've already had a surgery. Can you use Softwave after that? Yes, it helps. I mean, this is probably one of the things I've been most excited about recently is like I have a guy right now who's in the office. He already had one hip replacement. He has one of his original hips and he has one that's been um replaced, and both of them are bothering him. And the amount of pain relief that we've gotten in the hip that's already been replaced has been significant even after the first 2 sessions, because when you have a surgery, there's a lot of scar tissue that can build up around the metal or any of the cutting area, and if that's not dealt with accordingly, even post-surgical can still have a lot of pain and a lot of problems. So yes, if you have still having problems post-surgery, we can work on that area. Of course, sprains and strains, even broken bones, hairline fractures. Like I've used it to help heal a hairline fracture on my foot from all the marathoning that I did, help with wound healing. Those are the main things that I help with. They're starting to do more research and kind of evolve, like what are all the things that this can help with. I mean, really the question these days, the better question is not what can it help with, it's almost what can it not help with, because it helps with so many different things. They're using it for skin aesthetics. There's a lot of like spas that are using it for clear complexion on skin and improving scars and just the aesthetics of the skin. Women are using it to help with pelvic floor issues and instability, even like sexual health problems it's being studied on and stuff. We don't go that direction with the therapy in our clinic. We stick to the musculoskeletal pain issues, but it's just tremendous what this therapy can do. So that's a lot of the different things that it can help with. And if you are experienced, I'm going to go back to that slide for a second. Let's go back to that. Let's say you've got something going on. And if you're like older than 10 years old, you probably have dealt with or are dealing with at least something, because let's face it, life has a tendency to cause problems sometimes. So if you're experiencing any of these and you want to try this, on this next slide in just a second, I'm going to share with you how you can schedule your first discovery session and your first treatment. But maybe right now you're watching this and you're thinking of a family member, or maybe you're thinking of a friend right now, or you know somebody, you're like, oh my gosh, they need to hear this. Please share this video with them, share what you've learned with them. We want Softwave therapy to be a household name. There's so many people that are just suffering with pain right now, don't want to take drugs, don't want to do surgeries, don't want to do cortisone shots, don't know that this is actually an option to get them back to not only out of pain, but doing the things that they love to do in their life again, like being active, working out, being in nature, spending time with their family, or just doing simple, daily chores that need to be done without being miserable on a regular basis. So if you want to schedule your first appointment, here's how you do it. First of all, I'm going to go over what that includes. So you say you want to do it, you schedule your first appointment. On that appointment, what we do is we do an initial consultation, a physical exam of the area. And in our clinic, we take any x-rays if necessary. I would say half the time we do, half the time we don't need to. Plus, you get your first Softwave treatment that day on that first session. So again, consult, exam, x-rays if necessary, and your first Softwave treatment. That's a $350 value. And it's just $49. Why? Why is it so low? Because we want as many people in our town, in our area, to be able to have two things. Number one, at least have some insight of what's going on with their body. And we want everybody to be able to at least experience a treatment, see the machine, see how it feels, see how they respond afterwards. Because we know that if people just see this and if they just feel this, they're gonna be able to, they're gonna want to do it and they're gonna be able to get better. And so you can come, you can schedule your first discovery session. It's just $49. So it's a super discounted rate for that first one. And then we see how you respond. And then what we have to do, what the very next step is, we schedule a follow-up appointment, ideally about 48 hours or so, 24 to 48 hours after your first treatment. And we meet with you. We see how did you feel? How did you respond? And we go over your exam findings. We go over we look at any x-rays on that follow-up appointment if necessary. I put together a plan for you. Like, how many sessions is it going to take for you? How many sessions is it going to take for your problem to get back to full functionality so you can be feeling good again? And then we go over cost and the different ways that we make it affordable and we make it work for people with all different income ranges. So we're very proud that we have a lot of different options. We help a lot of different people be able to do this. But the first step, you got to just come in, see it, try it out, and then we go from there. So if you want to schedule, just text the word Softwave to this number right here. So 563-275-8719. Again, just text that word, text Softwave to that number. So whether you're watching live with me or whether you're watching this as a recording, you can still send that in and we will follow up with you, answer any questions that you have, help you get a time picked out that'll work for you, so that we can help you in the start to your journey to healing. And we'll go from there. And then what I would love is, if you go through this, we want to hear your stories. We want to hear your testimonials and hear how Softwave TRT has helped you.